Hi everyone, I'm Martin Tagano III, and for this video, we will be having a group study of the chapter 2 of this book, The Secret to Saving and Building Your Future. Chapter 2 is all about choosing the right healthcare. Choosing the right healthcare. So this is our topic for this book study. It says here, in the Philippines, a lot of people die not because there is no medicine or treatment available, but because they don't have money to pay for these costs. In the Philippines, we have one of the best hospitals in the world. I think that's their mark. St. Luke's in BGC or in Quezon City, it says in their advertisement, one of the world's best. I have a colleague, she worked there, she's a nurse, and she told me na ang daming foreigners na pumupunta sa kanila to get treated or dito sila nagpapagamot. So what does it tell us? Nasa Pilipinas, we have a hospital here in the Philippines na world class. Meaning, andun yung kalidad ng healthcare professionals like doctors, andun yung care, di ba? We Filipinos are known for that. So they're willing to go here just to get treated or just to get cured. But as Filipinos na andito na, what stops us from getting access to these quality hospitals, of course, is the financial resources. Like, it will really cost us a lot. One of the reasons is that kung wala tayong healthcare from the company, tayo yung magbabayad nun. If hindi enough, since mahal talaga magkasakit, doon na papasok yung instances na unavoidable that we have to spend our savings. Yung hindi pa natin for 10 years, pwedeng isang hospitalization, ubos ka agad. If hindi pa enough, magsasangla or magbebenta ng properties, of course, sa paluging presyo. Kung hindi pa rin enough, doon na magsisimula yung mangungutang tayo just to pay the hospital bills. So that's one of the sad realities that we have. Again, the Philippines, we have like St. Luke's, Asian Hospital, Medical City. These are really, really good hospitals, world-class hospitals. Although we want to access them, these types of hospitals or healthcare facilities, but what really stops us is the resources to access them or to pay for them. A study commissioned by the World Health Organization showed that most health expenses shouldered by private households as much as 48% of total health expenditures. So this will prove na most Filipinos don't own a healthcare plan. Because a lot of people would tell na ayokong kumuha or bumili ng healthcare kasi sayang if hindi ko magagamit. Parang they would treat healthcare as an expense. But then, we don't evaluate healthcare immediately. Diba? Parang, like insurance, we buy insurance if we don't need it. Because the moment we need it, doon natin ma-appreciate yung value niya. Ibig kong sabihin, say for example, bumili ka ng insurance ng bahay. Kung wala pang nangyayari sa bahay mo, hindi mo ma-appreciate yan. Yung view mo sa insurance is just an expense. But, the moment na nagka-earthquake, nasira yung bahay mo or nasunog, doon natin ma-realize yung importance ng insurance. Yung 2 million na niloan mo just to pay for your house, isang event like earthquake or sunog, mawawala yon. But with insurance, at least we have the opportunity to get that back. Ganun din when it comes to healthcare. Nagbabayad tayo ng premium. If hindi tayo nagkakasakit, hindi natin ma-appreciate. But the moment you get sick, if you have healthcare, andun yung ma-minimize yung magalaw yung savings natin just to pay for hospital bills. So our topic is choosing the right healthcare. So this means maraming klase ng healthcare. The first one that I will be discussing is yung tinatawag na short-term healthcare. Ano ba yung short-term healthcare? Bakit tinawag siya na short-term? Tinawag siya na short-term because maikli lang. Like you have to renew it every year. And this short-term healthcare is usually the type of healthcare being provided by our employer. It says in the book, so this is also known as the traditional HMO or Health Maintenance Organization. Generally, wala siyang life insurance coverage and it's very prone to have an increase in premium upon renewal. Or if masyadong malaki yung consumption mo or masyadong mataas, there is a high possibility na hindi ka na pwedeng i-renew or hindi ka na papayagan na mag-renew for the following year. Or the other way to say it is, papadalhan ka ng notice ng HMO, this would be your premium for the following year, masyadong mataas, almost double. So this is good as telling you na ayaw ka na namin i-renew kasi high consumer ka or very high yung utilization mo. And one thing also to note is, for short-term healthcare, it says here, there is no return of premiums for non-utilization. So that means, with or without utilization, hindi mo siya nagamit or nagamit mo once or twice or hindi, one thing is clear, magbabayad ka. So, to understand better yung short-term healthcare, just imagine na kumuha ka ng insurance ng sasakyan. Kung wala kang claim for that year, yung year na kinover ka ng insurance, tapon yung premium mo. So that's the first type of healthcare, short-term healthcare. The second is we have yung tinatawag na senior care. Bakit tinawag na senior care? Okay, yung short-term is i-cover ka lang hanggang 60 years old. Bihira yung i-cover ka beyond 60. Why? Because it's too risky for the HMO or for the healthcare company to cover you. Because the moment we hit 60, yan na yung lalabas yung mga kung ano-anong sakit natin. Or hindi man magkasakit, kailangan na ng maintenance or regular checkups or regular consultations. So see, the time that you need it more, yung HMO, saka naman siya wala. So what if beyond 60 na tayo? Anong healthcare na pwede nating magamit? So that would lead us to the second type of healthcare, which we call senior care. Senior, diba? Sa Philippines, senior is 60 and up. So this type of healthcare, it says in the book, it works similarly to the short-term coverage, except that, diba, it covers beyond 60. With Kaiser Senior Care, ang coverage is 60 to 100 years old. So it's an individual type of HMO and it's the most expensive program. And again, renewal is not guaranteed. Bakit expensive? The cheapest for Kaiser Senior Care, the cheapest is like 23,000 a year. But it's very important to note na ang senior care, it doesn't cover yung checkups and consultation. And it's designed for inpatient lang or for hospitalization kung kailangan mong ma-confine. And very important also to note na for senior care, there is a copay. Say for example, yung bill mo 100,000, yung unang 10,000 ikaw muna. Plus the 10% nung tira, yung 90% lang na remaining, yun lang ang issue-shoulder ng Kaiser Senior Care na plan. So again, very important to note, may copay initial 10,000. So 100,000, 10,000 ikaw muna, living as 90,000. So 10% of 90,000 is 9,000. So the remaining 81,000, yun lang yung issue-shoulder ni Kaiser Senior Care plan. So 23,000 is just is the lowest plan that we have. And ang coverage na I think is 250,000 per illness per year. So again, very important to note, inpatient lang siya. Hindi covered yung checkups and consultations. Kasi most of my inquiries, ang hanap is senior care pero parang yung HMO na meron sila during their employee years na gusto nila magpa-check up or consult, magagamit nila. Again, very important to note na hindi yan covered ni Kaiser Senior Care. Kung ganon, in-encourage ko na lang sila to become IMG members because one of our benefits is unlimited checkups and consultations for Kaiser clinics or Kaiser medical centers. So, to recap, so far we have two types of healthcare that we already discussed. So we have the short-term healthcare or what we call HMO. The second is we have the senior care. So again, short-term and the second type is the senior care na i-renew mo siya every year. Short-term ang coverage until 60, ang senior care beyond 60 usually 6,200. So the next type of healthcare is what we call yung long-term healthcare. So this is an HMO with a health savings account. So hindi lang siya purely healthcare. It has a fixed premium program, usually 7 years. So 7 years to pay. Minsan sinasabi ko 7 years to invest. So that ang perspective nila or ang view nila is not an expense, rather as an investment. Now I will save or invest for a future gain or for a future benefit. Then this type of plan matures in 20 years. So if you want to know more about the benefits and features of this, you can check like videos. I have one on my YouTube channel discussing yung Kaiser long-term healthcare. So it comes with a 4-way insurance coverage together with a long-term healthcare plan. Hindi lang siya healthcare, but it also has investment and insurance. And one thing to note na maganda sa long-term healthcare, it says here, renewal is guaranteed. And may money back. It says here in the book, all unused health fund accumulates with interest. So kung sa senior care and sa short term, walang balik ng premium for non-utilization, dito, kung naging healthy ka during the 7-year paying period, ima-money back sa'yo during the maturity. Hindi lang ima-money back, may interest pa kasi may investment component din. It may cover beyond age 60 with long-term care growth. Bakit may cover? Because it depends kung may natira sa account mo. So for example, high user ka or yung utilization mo sobra-sobra at nag-zero na, of course, wala ka na rin coverage. To avoid that, I would tell people na you get long-term healthcare designed for your retirement years. So habang nagbabayad ka or during the early years, lalo na kung hindi pa mature, minimize natin yung utilization. Kasi designed talaga siya beyond 60. So since designed siya for beyond 60, doon natin mas ma-appreciate yung benefits niya. Kasi yung iba, kumuha na long-term healthcare, ang view short-term. So gusto gamitin ka agad. Well, to maximize really, we get long-term healthcare for long-term consumption or beyond 60 years old consumption. We get short-term for immediate consumption. So, kailangan nating i-match yung kinuha natin sa goal natin. Then, we have sample benefits of having long-term healthcare. Of course, first, we have long-term care benefits. So, it says there, a guaranteed benefit which you can use after 20 years. So, it's guaranteed. Then whatever sickness you have, or you can also use it at age 70 onwards. So sa long-term healthcare, hindi covered ang pre-existing during the paying period. But beyond 60, lalo na on maturity, wala nang usapan kung pre-existing ba yan or hindi. Then you also have yearly benefits. A 10% yearly accumulation based on the long-term care benefits starting at the end of the 7th year up to the 20th year. So for example, you get a K100 plan, 7 years to invest. After the 7th year, nagti-10% interest na siya based on your plan type. Example, K100, so 10% of 100,000, so that's 10,000 a year compounded. Meaning, kung hindi mo na-touch yung previous year's 10,000 interest, mag-i-interest siya together with the interest in the succeeding years. Then you also have long-term care bonus. If no claim was made during the accumulation period, 85% of premiums paid will be given back at the end of the 20th year, making it cost-free. So, yun yung sinasabi natin kanina na may money back. Kung wala kang utilization during the 7-year paying period, ibabalik yung total contract price or yung binayad mo, 85% of that, ibabalik during maturity. So again, just to recap, so sample benefits, so we have long-term care benefits. After the 7th year, nag-i-interest na siya. Then, for long-term care benefits, may guaranteed benefits tayo beyond 60. Then yearly health benefits, yung interest na 10% after we finished paying for 7 years. Then long-term care bonus, ito yung money back. Then, in addition, very important to note, we have lifetime network access to the accredited doctors and hospitals. Anong significance nung access na to? Iba kasi ang rate kung through healthcare card compared kung walk-in ka. Parang wholesale retail concept. Mas mura ang sisingilin kay Kaiser ng mga hospitals compared dun sa mga walang card. Wholesale retail concept kasi with the volume of policyholders ng Kaiser, hospitals and doctors are willing to lower down their rates. On the average is 30% cheaper compared kung walang card ka, kung wala kang healthcare card. Then, just to emphasize yung money back, so cost-free health benefits, return of premiums for non-utilization. So again, I really encourage na during the 7-year paying period, as much as possible, wag mo munang gamitin except for the AP or dental para may money back tayo. Then again, in addition, we have accumulation of unused yearly health benefits and bonus. Ito yung compounded interest na 10%. Kung hindi mo siya ginagamit, kasama siya sa mag-i-interest the following year. Then we have term life insurance coverage. About 20 years before maturity, yung life insurance coverage natin, the moment we started the plan, may life insurance na tayo. Up to the 20th year. Basta hindi ka umabot ng 72 years old. So, ibig sabihin, kung 60 ko na siya nakuha, covered na lang ako for 72 minus 60, so for less than 20 years. So kung kinuha mo siya 20, maximize, covered ka for 20 years. That's for the life insurance coverage. Then we also have accidental death and dismemberment. So, example, for K100, ang life insurance coverage mo is 450,000. If ang cause ng death ay accident, so that 450,000 will be doubled, making it 900,000. Then, in addition, for insurance aspect, you have waiver of installment due to death or disability. Example, 7 years to pay on the 2nd year, namatay yung policy holder. So, yung plan, ita-transfer kay beneficiary, certificate of full payment, i-award kay beneficiary without needing for the beneficiary to pay for the balance. So, rendering yung 5 years na balance, nalibre na. And hindi lang death ang reason kung na pwedeng i-waive yung remaining premium. It also says here, waiver of installment and premiums due to total and permanent disability. So, ang ibig sabihin, bakit total tas permanent? It means na yung policyholder, kung ma-disabled, wala ng capacity to earn income. Wala na siyang capacity to pay the premium, kaya siya i-waive. Kung partial disability, kailangan pa rin bayaran. Then, this leads us to this 4 cornerstones of healthcare. Ito yung, di ba sa Rotary, parang may 4 questions na common nating nakikita along the roads. So the 4 cornerstones of healthcare, so we have short-term healthcare, long-term healthcare, life insurance, savings and investment. So ito yung, as much as possible, yung healthcare block natin would incorporate all of this. Short-term healthcare, that may short-term healthcare tayo, so that we can avoid using our long-term healthcare kaagad-agad. Kasi we want na yung long-term healthcare natin, magamit natin after maturity na. And Of course, yung healthcare natin, dapat meron ding life insurance component. Bakit? At least, if something happens to us, na hindi pa tapos yung plan, ma-waive yung premium. Or, kahit tapos na nating bayaran yan, may mangyari, at least kaagad-agad may matatanggap yung beneficiary natin. And also, very important na meron ding savings and investment. Kasi during retirement, hindi lang naman healthcare ang problema natin. Diba? Hindi naman natin pambili ng grocery ang healthcare natin or pambayad ng bills. So, it also pays na yung healthcare program natin may savings and investment component. So then, this leads us to the final test of a good healthcare. We ask ourselves, so does it have both short-term and long-term healthcare coverage? The answer should be yes. So imagine mo, kung kumuha ka na ng Kaiser Long-Term Healthcare, sa kinuha nating plan, sa kinuha nating Kaiser Long-Term Healthcare, we ask ourselves, yung Kaiser ba na kinuha natin, merong short-term and long-term healthcare components? Yes. Does it have guaranteed renewal? Yes. Does it have guaranteed savings and investment? Yes. Does it have life insurance or protection? Yes. So, again, choosing the right healthcare, you evaluate yourself kung anong need mo. For me, ideally, yung healthcare natin should have this. Yung questions that we've discussed, dapat lahat ng sagot dyan ay yes. Dapat may short-term tayo, for immediate consumption, lalo na kung hindi pa nag-retire or bata pa. Meron din dapat long-term healthcare so that when we get out of employment, wala na tayong HMO or wala na tayong short-term, we have our own. We also should have life insurance, thinking of our family if something happens to us, may marireceive sila. And also thinking about our retirement years, meron din dapat siyang saving and investment component. So that's all. I hope you learned something from this book study. Thank you.